Today is hello and welcome to the 9:30 call. I see Sarah Muncie here, who's going to have an announcement for us before we get started. So, Sarah, I'll turn things over to you. And then, as I said, Aditi and Christy will be back next week. And today is a follow-up from a previous 9:30 call. So, Sarah, why don't we start with you?
Okay, I'll be so quick. Hi, everyone. I just wanted to say that Neighborhood Villages is so excited to be presenting a film called Make a Circle. It'll be free at the Strand Theater on November 12th. It is an incredible and beautiful documentary that's going to be released on PBS. They're calling it a love letter to early childhood educators. It follows the story of FCC providers in California and their advocacy, and it's really cool. And they are amazing in the way that so many of you on this call are amazing, the folks in the movie. There'll also be a panel discussion, refreshments. It's all free. And I will put the link to the Eventbrite in the chat.
Great. Thanks so much. So it's November 12th.
Yes, at the Strand.
And Aditi says she is already registered.
Okay, I'll put it in right now.
Great. Thanks so much, Sarah. And now, Aditi, I'll turn things over to you. You are no stranger to the 9:30 call. Here, kind of in a different capacity than typically. So we're excited to hear your update.
Thank you, Amy. Hi, everybody. Good morning. For folks who are new, and I'm so happy to be back in community here with everybody. My name is Aditi Subramaniam, and the Director of Infant Early Childhood Mental Health Policy at the Mass Society for Prevention of Cruelty to Children. And this call, and I'm holding in mind my colleague who I will actually hear, Andrea Goncalves Oliveira, who is the Infant Early Childhood Mental Health Policy and Initiatives Lead at the Department of Mental Health. Our hope today, and I'm going to say our because we're holding her in mind, she's on medical leave. And so we're sharing this collective work together. It by no means is work just that Aditi and Andrea have done, but we're spearheading the work that everybody collectively is doing in the state. Like Amy mentioned, today's call is really a follow-up from Megan Schmetzler, who was here from 0 to 3 last month, to be able to share what the national work with infant early childhood mental health and policy looks like. And we wanted to really hone in, what is that looking like in our state in Massachusetts? And so my hope is to do a little justice to share where we've been and what we all are collectively working on in collaboration with the agenda and the 9:30 call and all of you. All right, but to begin with, Sarah, you had a beautiful preview for us for really celebrating the workforce. This week is Celebrate Babies Week, friends. October 21st to 25th, nationally and now internationally, is Celebrate Babies Week, which is really a week to celebrate expectant parents, babies, families, and adults that care for them, including each one of you and each one of us, right? The workforce that really nurtures and supports relationships around babies in the Commonwealth, across the Commonwealth. We are going to have a 1-hour drop-in meeting. It's not even a meeting, it's a gathering on Thursday as a way to really come together as a Commonwealth and not just celebrate our collective accomplishments, but really what is our commitment for years to come, so that families and babies and expectant parents really feel that they can thrive with their babies in our state. And so please join us. I will drop the link, the registration link in the chat. It is a 1 hour. Feel free to bring your lunch virtually. It is virtual. And so this is day after tomorrow. And for folks that know us, we're not going to start just talking without actually inviting you to participate in. So we have a little Mentimeter for you. And if you would, use your phones at this moment, or you could go to menti.com and use the code and just spend a couple of seconds or a minute, just one way that you celebrate babies and families, professionally or personally. And what I'll do is I will put the link in the chat and actually share the Menti so we can collectively see, how do we as the 9:30 call folks gather to celebrate babies together.
Thanks, Aditi.
All right, give me 1 second. Multitasking, not really helpful for me, but here we go.
Well, Aditi's getting the link. Reminder that tonight is banner night for the Celtics. The Boston Celtics will be raising their banner for the 18th championship. Okay. Had to get that in there.
Yeah, my daughter told me this morning, I got to wear green to school, Mama.
Yeah. I mean, I don't know what she's talking about. That's great. Okay, thanks for the link. So folks should be able to head to the Mentimeter.
I'm going to share my screen and folks can see. All right, there we go. Listening to caregivers smile at babies whenever I see them in my community. Yes. Smile at every baby I see and acknowledge them. Encourage my young niece's individuality. Supporting them in any way that I can to make sure they hit their important milestones. Keep these coming. This will keep populating. Read to them. And if the mentee is hard, feel free to please add it in the chat. Thank you, Sarah. Waving at babies whenever they wave at me, right? Hard not to. Connections. Absolutely. You know, and we'll keep this up. And actually, Amy, if we could send this as a post follow-up, and then actually once it's populated, we'll share it across with everybody.
Absolutely.
As a How's 9:30 call, celebrating babies and families. Be available and non-judgmental. Thank you. Oh, and it'll keep filling. Oops. Oh no, that's not what I wanted to do. Okay. We will keep filling the mentee. We'll share the results with everybody. So just a brief overview of, you know, why when we say infant early childhood mental health, folks might hear also the words early relational health. And really, you know, when we're thinking about both early relational health and infant and early childhood mental health concepts, they both come from the same vessel of really supporting that capacity, which is developing for our youngest from prenatal to 6, to really form close, secure relationships with their nurturing caregivers around them, to manage emotions and to explore their environment, all within the context of their culture and community. And so this is not only focusing on the dyad and the attachment, but really paying attention to what does community well-being look like? What does it look like to support the caregivers who are also surrounding our youngest, including parents and also the workforce? And so as we're thinking about policy and advocacy in Massachusetts, we've really tried to center in infant early childhood mental health collective impact as a way to, I think when Andrea and I started our role, it was, there's so many amazing things happening in our state in Massachusetts. And we sit at the feet of so many folks who've come before us. And at the same time, because we have so much, coordination is nearly impossible. And so instead of coordination, how do we really pay attention to really being that the idea of collective impact, that we have multiple community members and organizations, including our state partners, who are really coming together with centering equity at the center of how do we want to really create systems level change so that babies, expectant parents, families, young children, workforce, like all of us are really being able to thrive, not just do okay, but thrive, right? And so if we don't ask the question, we're going to continue to reproduce, right, in equitable ways. And so a big part of the policy work has been to consistently at every gathering and every part of like advocacy, whether it's an advocacy strategy or it's a state policy piece, to think about who's most benefiting, who is harmed. Are people who are the most harmed participating in actually creating structural solutions or not? I think the agenda has been a big part of really witnessing what that looks like in action, right? By having lived experience partners right at the table. How are race, power, and privilege operating to really maintain the outcomes? And how can we really pay intentional attention to system, like really starting to challenge and disrupt patterns of oppression, right? And so that has been, and this is not STAR, right? So how do we keep working towards this? It's not one and done. And so what Megan came and shared with us this was her slide, that one of the babies for the 0 to 3 organization is their financing policy project. And they've had now 3 cohorts where they really work with states to be able to build strategy on infant and early childhood mental health policy and advocacy. Massachusetts was in cohort 1. Neither Andrea or I were a part of that. Our senior leaders were, and they created pathways for actually really strategically all the things that have happened in the state. And also created the positions of both public and private, which is Andrea's position in state government, which is a public position, and then my role outside state government, which is in private nonprofit. However, right, the work didn't start in 2016. We have to always think about, in order for us to move ahead, we have to really invite the Sankofa bird as a symbol of, we have to look back as we move ahead. And while doing that, to make sure that we're planting seeds for future generations that come after us. And so in service of holding the Sankofa bird analogy, want to just show there's a lot of visuals on the next few slides. I won't touch all of them, but since it's recorded and you'll have the slide deck, it's a timeline of really infant and early childhood mental health efforts in Massachusetts, that when it started. And this is, I'm calling Kate Roper in mind here. This is her legacy of really pulling this together, and we are building upon. And so, really thinking about from 2000, like the 0 to 3s, 0 to 3 was established in the 70s, but 0 to 3's policy center was established formally in 2000. And you could see in our state from 2001 onwards, we had the Governor's Commission on Children's Mental Health. We had comprehensive systems grants in 2003. The Mass Child Psychiatry Access Program services began around 2004, 2005. Department of EEC was created in 2005 on July 1st. The Children's Mental Health Campaign, which is a combination of 6 organizations that come together, MSPCC being one part of it, Boston Children's Hospital, and 4 other partners, really was established in 2005, 2006. And then MassAIM, which is our state's infant mental health association, began in 2006, 2007. And you could see all of that led to, as it gets in the early 2000s, you can start to see how much more intentional effort was really looked at on what are the strategic priorities to start to focus on early relational well-being, and that early childhood mental health needs to also be a part of advocacy agenda, and children's mental health matters. And so, that then, again, the early 2000s to like we're in 2015. The Children's Behavioral Health Initiative was in 2009 from a lawsuit. Massachusetts became a pyramid model state. We were awarded the Project Launch Grant nationally and the My Child System of Care grant to a Department of Public Health and Boston Public Health Commission, which actually then led to really an explosion of what does early childhood mental health look like from a systems perspective. There was advocacy on ACT relative to postpartum depression. Mass home visiting began. So there's a lot of things that started to move in the 2000s. In 2015, MassAIM, in partnership with EEC and Department of Public Health, really purchased the competency guidelines nationally from Michigan into our state, which was the first way to recognize the competencies and skill sets for the workforce to really work alongside families and young children from a relationship standpoint, with infant early childhood mental health at the center. There was a lot of money in our state with Race to the Top, and all of that actually was how these things moved. And then this one, the dotted lines are still there because we're still adding to it, and I want to make sure that I'm not the only one adding to it, and so you don't see all of it right now. So 2016, this is where Megan left us off. 2016, Massachusetts was participating in the financing policy project. And from there, where there was a group of 5 members across the state. So our executive director, Nancy Allen Scannell, Department of Mental Health, Mass Health, MassAIM. There was 5 folks who got technical assistance, and really a part of that, what that led to was our first statewide infant early childhood mental health summit, which with a combination of Children's Mental Health Campaign, DPH, DMH, and EEC. I think a lot of folks maybe in this room participated, but that summit was the first one that actually, at the summit, there was a co-creation of what are the state's strategic plan for the next 5 to 6 years, which was published in the Policy and Practice Report in 2017. And then there have been Children's Hospitals, DON, and funding in the state. MassAIM adopted the credentialing system. It led to also what Megan mentioned, establishment of cross-agency IECMH leadership, which is a public-private partnership. And then from 2019, from where Andrea and I started our roles, this is by no means only our work. This is all the statewide work in infant early childhood mental health that has been happening, and there is more, right? It really has led to more targeted and focused public-private partnership. There is aligning goal with other stakeholders in the state, coordination with state agencies that are involved with young children and families, which are mostly all, because families with young children navigate all of our systems. Andrea facilitates an in-state policy work group at the Department of Mental Health, which is between state partners to come together. And I facilitate a children's mental health campaign advocacy work group, which is out of state, which out of state government, we have state partners and community partners. And I know some of you here are a part of that. And, I think this is also a call to say we would love for you to please participate and be there. And I also recognize that sometimes it's hard in the morning from 10 to 11:30. And so maybe I'm like, Amy, maybe I will bring some of that here to the 9:30 call, right? And there are subgroups across our state that's working on integration of infant early childhood mental health and primary care, trainings, public awareness. We're tasked with writing the next policy and practice report, because what has been really beautiful out of this work and all these efforts with now there is Mass Child Psychiatry Access Program for early childhood now in our state that Department of Public Health holds. There's a Transforming Massachusetts Pediatrics grant for early childhood. So there is so much movement happening that sometimes we actually don't pay attention to all the celebrations. The strategic plan from the last 7 years, everything in that strategic plan, the recommendation has been met collectively as a state, right? So just breathe into that. Each of you are a part of that process. You can see there is like ACT addressing barriers to care for mental health, addressing suspension, expulsion, early childhood mental health consultation grant, maternal health bill just passed in August, increasing awareness, right? All of this is work that has been happening. And I think really, knowing that all the recommendations over the last 7 years have been met from that first policy and practice report, we don't just tie it up and say, great, we're all set. Our hope ahead is then to see, all right, so what next, right? And in the policy work group that Andrea facilitates and the advocacy work group that I facilitate, and really there are regional work groups in IECMH across our state, we have really over the last year harvested values from community members, listening to all of you in the 9:30 call, really being able to really harvest not just values, but what is the next 5-year strategic plan for infant early childhood mental health in our state, right? What are we going to do together? How are we going to work towards it? And so we spent a year and a half with a bazillion Google documents. They did not look like this. They really centered on like really working meetings of everybody writing, what are they noticing in their community? What are the needs? And what we have tried to do is collate it into 4 buckets of policy and systems work that will continue, which focuses on some financing work, investments, cross-braided funding, reimbursement for folks who are doing, I think related to pay, billing for practices like reflective supervision, really paying attention to infant early childhood mental health with the unhoused families and immigration. Second bucket about promoting universal awareness. I think what has been really lovely over these last 10 years is I think finally when we're with legislation, we don't, when we say infant early childhood mental health, people don't like look at us like you have 5 heads, right? Like babies, mental health. So that says so much that we are all collectively messaging that mental health for young children matters, and mental health for young children is really impacted based on their relationships with their caregivers around them. The third bucket is workforce, right? How do we continue to integrate and support each of us in the work so that we can continue to be in this relationship-based work without getting burnt out? And then the fourth bucket is really equitable access to services for families. And so with all the multitude of services that we have in our state, sometimes navigating them is really hard. And our youngest and families sit in all the systems. And so how do we really be intentional and think about, how are these principles of infant mental health and early relational health being centered? How do we really center family voice and choice and really center, race explicit but not exclusive, really thinking about what does that look like in policy and advocacy. And so this draft is started, right? We spent 1.5 years pulling and gathering and harvesting ideas from everybody across the state. And what the next step is going to look like is let's start to engage with buckets specifically. And so that is going to happen over the next, right, 5 years, 6 years, and strategically start to think about what are those buckets looking like? And maybe something that the state government is going to do is something that advocates will do, right? Everybody has a different role to play in this collective work. The Children's Behavioral Health Advisory Council is the Department of Mental Health facilitates it. The council report this year has infant early childhood mental health as one of the priorities. So it's really neat to see how both in-state and out-of-state priorities are kind of coming together. And we are tasked at the Children's Mental Health Campaign and putting together the next policy and practice report to really look at how do we collectively think about recommendations based on what we've heard from everybody for the next 5 years. And then what is that and how does it link with the agenda? And then I will stop sharing my screen because there's a lot of information on this. I think we've spoken with Amy and team strategies and the agenda, I think thinking about what does it mean to connect the threads in this collective tapestry for early childhood. And within the infant early childhood mental health pieces, how do we support and collaborate in ways that can really link with the agenda's work and link with the system's work with mental health. And so I think one is we would love each of your voices and input in this co-creation of let's start to work on those buckets, but also is there anything missing in those buckets, right? It was very clearly written as draft. The Children's Mental Health Advocacy Workgroup meeting that I facilitate, these are the dates. They're from 10 to 11:30 if folks can join. Please email me. I would love for you to be there. If you can't make it for all meetings, we will send you updates. And then I think a big question is, I recognize 10 to 11:30 is a big chunk of time for folks to join. Are there other ways, and this is a question, that we could have really engaged the 9:30 folks to be involved in this co-creation of the strategic plan or working on the strategic plan for IECMH? And I'll drop our emails in the chat, but that's the history of the work together.
Well, I think first, I'm so glad we recorded this call to have you walk through, that history and then kind of where we are today is so powerful to see how connected and thoughtful and intentional, not surprising, but it is always amazing to see that. There was a question, Kim added, Kim Davenport, fabulous reminder of all that's happening across the state in early relational health, exclamation point. And speaking of the agenda and work group 6 focused on local infrastructure, what are 2 to 3 things you would recommend communities do to connect and integrate into this work? So maybe that's one bucket of work. So 9:30 call, but what about also this local piece?
Yeah, absolutely, Kim. Thank you. Such a great question. So I think some of the work has been the Western Mass has an IECMH roundtable, Southeast has a task force. And so what we have done is have invited and had folks from those groups come and join the policy and advocacy work groups. And I'm now joining those mini local community groups to say, we know everybody can't make it to the statewide meetings. So let us bring this to you. And so I'm wondering whether, if there are parts I think, Kim, if there are work groups and community work that you're thinking about, right? I think systems gaps and within the local community, what are needs? For example, we're doing a systems mapping across the state that really came from listening to each of you and folks across the state to say, in Western Massachusetts, we have a lot of promotion prevention services. We don't have any intervention in clinicians. And, and so really, and I'm saying generally, but it shouldn't be anecdotal. This should be evidence that we all have so that there can be strategic funding. They can be from state, but we can really prioritize as a state, what trainings look based on place-based need, based on what communities need, versus just having a broad strategy. And so I think some of it is, what are 2 things you'd recommend communities to do is I would almost be we want to listen to what are needs coming up for you so that we can really pay attention to integrating that. Because communities know what you need in a certain area is what that gets built up based on a certain need. It's not across the state. It's not all the same. I will say if there are ways to really continue to elevate that early childhood mental health and early relational health is really supporting the well-being of both and, right? It's not just child. We have child-based services and we have adult-based services in our state. What we're saying is we need both and together because it impacts both well-being of child and the grown-up, like almost two generational or like multi-generational. And I do see Donna absolutely there. So there's MCPAP for autism. Yes, there's MCPAP in so many different iterations.
And Aditi, maybe there can also be a set of questions that we can give to local communities as they're doing any kind of birth to 5, birth to 8 planning, that could help focus, because you know, to listen, because you always have such good questions too.
That's a great idea. Yeah. And I think oh, sorry, go ahead.
No, go ahead. No, go ahead.
No, I think Yolanda, I don't know if Yolanda's here. I know Worcester had their, they're like, let's listen and lean into questions for early childhood. And one of over there, we were able to actually name specifically, like, how do we elevate early childhood mental health and early relational health when we're thinking about young children through like the work TFK was doing in Worcester Cares.
And just that Kim also suggested kind of we carve out a 9:30 call each month to support this work. So that would be a great idea. We're becoming all about the series here on the 9:30 call.
Love it.
And so Aditi, when you because I think and I think having more time, I mean, you and Christy coming on you know, has been incredible. And so maybe we also make sure that we have time like this to come on and have you and Andrea come back. And any other folks, you know, if folks have ideas about people who are kind of living this work, let us know, because we would love to hear from them as well. What does this look like in action, in a community, in a program, especially like collaborating. I love what you talked about. I forgot the race to the top with the public and private, right? There was a real big intentionality of thinking about how to build this infrastructure.
Absolutely. And I think it's been a big part of how we have moved things in our state is to really intentionally have that public-private partnership. And I know it came from that 0 to 3 2016 piece came from that. Like I remember very explicitly, that was one of the strategies. Right. I was pulling up the slides, which like it was really interesting to put the timeline together. I mean, I had case slides and then like pausing and saying, oh my goodness, there's been so much collective work and we have so much more to do, right? And being intentional for like, what does it mean for 7 generations ahead without, and Cherish, I really appreciate you naming absolutely, having the ERH. So folks in the ERH community of practice are involved. I know Lisa is involved, she's a part of the the advocacy work group. And I wonder whether we could actually also do more of it. So yes.
That so that wraps it up for Kim. Also added it would be the concept of elevating early childhood mental health and early relational health would be great to connect with the public awareness campaign of work group 8 and I think it's the work group 9 around thinking about health and early ed. Aditi, it's always fun to hear your thoughts and work here. So much to learn. I look forward to hearing. Oh yes, Aditi is headlining the Babies and Toddlers Conference that the Greater Boston Early Education Network is putting on in November. So that's great to see, Aditi. And we will take all these suggestions and figure out how to, and obviously the early childhood agenda. What does it look to integrate that in that work? So Aditi, thank you so much for joining. We're thinking of Andrea. And we will see everybody back here tomorrow for the 9:30 call, where we will be hearing from Lift Our Kids Coalition and Naomi Meyer. This is an early childhood week, agenda week on the call. All right, have a great day. Go Celtics.
Thank you. Go Celtics.
Thanks,
everybody. Thank you.
Oh, Sterling Thunder would be fun.